Thank you for joining us today. My name is Fiona Miller. I'm a professor at the University of Toronto and the director of Cascades, which is a new national initiative funded by Environment and Climate Change Canada for climate action and awareness in healthcare. Before we start, I'd like to take a moment to acknowledge and reflect on the lands from which we are all joining this gathering today. Cascades operates from coast to coast, and as a result brings together individuals living and working on many different lands, which are the traditional territories of many different First Nations, Métis and Inuit peoples. I myself am joining today from the traditional lands of the Huron-Wendat, the Seneca and the Mississaugas of the Credit, and I am grateful to have the opportunity to live and work on these lands. And as we discuss changes to systems and practices in health and social care, we have an opportunity to reflect on what actions we can take towards reconciliation. And so now I'd like to introduce this session and the series of which it is part. This is the second of two webinars, or three rather, webinars coordinated by Cascades in partnership with organizations from across Canada, really to reflect on the implications of Canada's commitment to the COP26 health program. As many of you will know, at the last United Nations Climate Change Conference, the Conference of Parties in November in Glasgow, Canada, as a federal government, signed up for the WHO health program, which called for countries to commit to delivering climate resilient, low carbon and sustainable health systems. So with colleagues from across the country, we wanted to ask, what does that mean for us? What's next? So we started the series in January with an introduction to the commitment, and this session now digs in to the issue of climate resilience. How resilient are our health systems? What will we need to do to address the growing challenge of climate change? And to help us consider this, we are, with great thanks, joined by experts from British Columbia, which, as we know, has been really sorely tested by extreme weather events over the last year that are clearly linked to climate change. So I'd like to introduce our three speakers. Dr. Michael Schwant is a medical health officer with the Vancouver Coastal Health Authority. Michael is also clinical assistant professor at the UBC School of Population and Public Health. He serves as local medical health officer for the city of Vancouver and also provides region-wide public health leadership in health protection, environmental public health, and healthy built environments. So through these public health programs and also research, Michael works with partners, including municipal governments and community-based organizations, to identify and act on the core determinants of health. Emily Peterson is also joining us. She's an environmental health scientist with Vancouver Coastal, who works on knowledge translation, policy assessment, and tool development for a wide range of environmental population health topics, including air quality, climate change, course connected, and healthy community design. Emily works closely with local municipalities and regional districts on planning and policy decisions. Craig Brown is also joining us. He is a climate change and health lead at Vancouver Coastal. He's also associate faculty member at Royal Roads University in the Master of Arts in Climate Action Leadership program. So as a planner, Craig supports climate change adaptation projects in the health sector with a strong emphasis on community collaboration. He's also an author on national and international climate assessments, including a forthcoming part of the sixth assessment report for the IPCC, the Intergovernmental Panel on Climate Change. So thank you very much, Michael, Emily, and Craig, for joining us today. And I'm going to hand it over to Craig to take it from here.
Thanks very much, Fiona, for the warm introduction. And thank you again for inviting us to share our work. It's been a journey that all three of us are very proud of and always thankful for the opportunity to present. So with that, I think you should be seeing my screen and I will commence with the presentation. So to begin, I'll acknowledge that Michael, Emily, and myself do this work from the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. Very grateful to have that opportunity. And, you know, as a team, I think we're really getting better every day at finding ways to center and support Indigenous leadership on creating healthy, equitable, resilient communities. There's so much amazing work going on in our region, and we're really happy to find the best way to support and center that work. Also grateful for all of your time here today. Again, very, very excited to be here. I'll jump right in and give you just a brief overview. I'm sure some of you are from outside of BC, and so it's useful to remind you what Vancouver Coastal Health is. We're a a fairly large health authority serving over a quarter of BC's population. And in addition to operating and offering services through 13 hospitals, I've listed here in sub-bullet some of the other services that we provide, just to give you a sense of the breadth of the organization. So there's primary care, all of our residential and home care, mental health and substance use, as well as public health, which is where all three of us are from. We work in what's called the Office of the Chief Medical Health Officer. So just again, to give you a sense, especially those of you from places where the health system isn't quite organized this way, just useful to remember where we're sitting and coming from. So today, three speakers, three parts. I'll do a brief overview of climate change and some of the health impacts that we've researched and observed here in Vancouver Coastal Health. Emily will take you through some of the work that we did around the heat event last June, including some of our climate vulnerability mapping. And then Michael's going to take us to that more health systems level and talk about how the resilience of our health system is tested and how it's responding to the events that we're already experiencing and in anticipation of those that we will experience. So I will take us right in with a very familiar slide for those of you that have worked in British Columbia, and probably for those that haven't as well. This is really just serves as a reminder to me of two things. You've got here the blue line going off to the right being kind of our most optimistic climate future, and the red line going off to the right being our least optimistic climate future. And the point is that around 2050, these lines are largely still converged. So we're locked in to a certain amount of change, no matter how well we do. And we need to be preparing for a trajectory that is that considers the red line to be a possible future outcome. Obviously, it's not the one that we're working towards, and many of our colleagues work aggressively on mitigation. Emily and Michael get to do more of that work in their day-to-day than I do. So we're still actively working in climate mitigation, but the slide reminds us that we're locked into a certain amount of change, and there's an awful lot of uncertainty here that we need to get prepared for. We also really don't need much convincing anymore, especially in British Columbia. I've been in this space long enough to observe that these extreme climate events are a bit like a game of whack-a-mole across the country, where it's New Brunswick's turn sometimes it's Alberta's turn, sometimes Ontario, and this 2021 was certainly British Columbia's turn to experience just the massive impact that climate-sensitive hazards can have on our quality of life. And in addition to the extreme events, we're going to talk about the heat dome and the atmospheric river event that we experienced last November. But I think it's also important to remind us that there's a real window of opportunity here right now, as seen by the broad range of actors getting involved in this topic, and as seen by the project Fiona's leading and the inclusion of us in this webinar itself. So we're continually trying to figure out the best way for us as a health authority to contribute to solutions in this space. And I think that the time is great for this, and we've been fortunate to receive some support from Health Canada. So my job up until about 5 weeks from now, for the last 3 years or so, has been to lead a project called Health Adapt that's funded by the Health Adapt program that Health Canada offers. And what it is 4 entities came together to undertake a formal climate change adaptation planning process. And this forms some of our work that we do on climate adaptation at Vancouver Coastal Health, in partnership again with Fraser Health, with Health Emergency Management BC, and with our colleagues in facilities management. But it doesn't form all of it. Certainly, Emily and others were quite active in this space before the grant came along, and we plan to continue to be active in this space after the end of this fiscal year, and really intend to make monitoring and planning for climate vulnerability and increasing our adaptive capacity just part of business as usual. Some of you might be familiar with the term mainstreaming, but really just baking this into public health programs such as surveillance, health protection, communicable disease. So that's, again, just an important part of our story here at Vancouver Coastal Health of thinking about climate resilience. What I'm going to do is just take you through a few slides that just really put a fine point on some of the hazards that we face and some of the impacts that they can create. So you can see in the background, we've produced a communication kind of infographic that takes folks through the primary hazards that we face. And you can see the two in the foreground here are extreme heat and poor air quality. And Emily is, of course, going to do a deep dive on extreme heat. I think most of us, certainly on this call, and most of us even in the public now, are pretty tuned in to how heat can affect our health, especially those folks who experience higher than normal risks, be they folks that are socially isolated or elderly or experiencing mental illness or addiction. So heat, obviously, even out here in temperate British Columbia in the lower mainland, still, as the heat dome demonstrated, a very serious hazard for us. Poor air quality and wildfires, it's for here, and again, I'm not going to go through all of the sub-bullets. I think that some of that will come out in the conversations as we go. But for now, the reminder is that we experience poor air quality not just from wildfire smoke, although that's a large contributing source, obviously, but also through processes that create ground level ozone, which can cause, again, many of those conditions outlined in the bullets. As well, and it's something that doesn't get always spoken about, but the increase in aeroallergens as the climate continues to change here is something that's worth considering, because it does impact quality of life and health for a variety of folks in our health region. On to an impact, or a hazard rather, that before November, obviously was on our radar. Flooding is something that's impacted British Columbia forever. But the events, the atmospheric river event that Michael will go into a bit of detail in later, really drove home how these events, especially linked to extreme precipitation, can create all sorts of challenges in our communities and with our health services. We saw a number of landslides that disrupted our highway infrastructure out here, power outages, and all of the things that go along with that. And in addition, because we're a coastal health authority, we obviously need to consider the impacts of sea level rise and changing coastal conditions, which can lead to all sorts of impacts direct to facilities, for example, but also as listed here. It can affect groundwater quality, it can affect access to traditional foods, all sorts of impacts. So the final category that I'll speak to, and again, this resource is on our website, which is vch.ca/climate change. We've got many more on there and many more coming. But what I'll speak to here is just the importance of considering those, sometimes we call them slower onset hazards. So these changes that are going to unfold, over the span of decades, we might not see dramatic changes in say the spread of infectious disease right away, but we do need to be prepared for it. So too the changes to our ecosystems, which for us really drive home the connection between climate change as a gradual process and food and water quality, safety, and security. We've seen that, especially in some of the engagement we've been fortunate enough to do with our Indigenous communities, that clearly highlight the connection between food security, access to traditional foods, and a changing climate. And in fact, our colleagues at First Nations Health Authority are doing some very cool work on that, called the WATCH, W-A-T-C-H program, if you wanted to Google that. So I'll finish by just sharing that we have produced, all of those hazards are described in immense detail in a long form review that brings in all of the available internal data, engagement with experts and community members, as well as just a very thorough literature review on the hazards, on the vulnerabilities, on all of the various health impacts, as well as our adaptive resources that we had in place at the time of writing. So that's going to be released imminently. We're just kind of preparing that for online production, but we knew that we had to synthesize that material into something shorter, because again, this work for us is all motivated by connecting to action and by informing decision makers and by increasing collaboration. And so we've got a short summary report that's a nice looking PDF that we'll be able to share with all of you soon and with all of our community partners. So that's a bit of what we've been up to from my perspective. And with that, I'm going to pass it over to our environmental health scientist, Emily Peterson, to take you through a little bit of the work around the heat event last June.
Great, thanks a lot, Craig. So I'll provide a high-level summary of the heat dome event and impacts, and also the vulnerability mapping project that we've been engaged in for a number of years now. Next slide, please, Craig. So as many of you know, BC experienced a significant heat event this last summer. This event was very early on in the season. It had record high temperatures, including the highest temperature ever measured in Canada, in Lytton, BC. It covered the entire province of BC, and it was long lasting, going from June 25th to July 2nd. And as those of you who have been involved in health impacts research related to climate change, all of these factors are quite significant from a health perspective. And this heat event brought us, the early season, the record high temperatures, the long lasting event. So quite significant from a health impact perspective. So this image here, sorry, Craig, back to the other slide. This image here is from the hottest day event, which was on June 28th, and it shows the temperature anomaly during this event. So we were looking at temperatures that were more than 15 degrees above normal for that time in the season in BC. And it also led to a number of cascading impacts from the event, which included extensive wildfires, including the destruction of an entire community, Lytton, melted snow caps resulting in flooding across BC. It wasn't as significant as the atmospheric river event that Michael will talk about, but there was still some flooding from that. And then also damage to the food crops across the region. Next slide, please, Craig. So the strength of this event in BC is quite clearly linked to our changing climate. A number of climate scientists have said that it was very unlikely for this event to happen if we didn't have climate change. And it's an example of what has been predicted for our region. So for the Metro Vancouver region, the climate science predicts that we'll see an increase from 2 days above 30 degrees to 14 days above 30 degrees by 2050. And we also expect that the frequency of many events are going to increase, including this event similar to these heat events. And Craig's covered it quite well, but I'm sure many of you on the call know that these heat events in particular have very significant health impacts, including mortality, heat stroke, exacerbation of existing conditions, mental health impacts, and also impacts on pregnancy outcomes as well. Next slide, please. So I'm going to go through some of the data on the mortality data impacts for our region across BC, and also on our emergency department visit data. So this slide here comes from my colleagues, Kathleen McLean and Sarah Henderson, who've been doing some fantastic analysis of this event at the BC Centre for Disease Control. They've recently released a publication on this work. And it looks at the estimated excess deaths during the heat event from June 25th to July 2nd across BC. So for those of you who are not familiar with excess mortality and how it's calculated, what we do is we create a model that determines the expected number of deaths each day based on what we have seen in the past in BC. So kind of those green lines that you can see there, those green bars show you, mortality that we can kind of expect to see. The black line here represents that expected death based on the model. The red colored area and the orange colored area shows when mortality is going above what we'd expect to see. So the difference between what we would expect to see and the mortality that we end up seeing is called excess mortality. So the BC CDC has estimated that during this event, there were about 740 excess deaths, which is huge and heartbreaking. and extremely significant. Just to provide some comparison, we had a heat event in 2009, and during that heat event, we saw 120 excess deaths. And that heat event was seen as, before this one came along, as one of the large heat events with significant mortality. And this one, it just blew that one out of the water. So I just wanted to point out a few things here. The dotted line here represents the hottest day of this event, which was June 28th. And as you can see, mortality actually peaked on the day after this, which is typical of other heat events in the literature across the globe. I also wanted to let you know that I haven't shown it here, and I'm not going to go into the details, but they've done some great work on looking at who is at most risk and what communities and where these individuals came from, and also looking at neighborhood factors. And this event showed that people experiencing mental illness and substance use were at a particular risk of mortality during the event. They also found that neighborhoods that were experiencing social and material deprivation were particularly impacted. And of course, what we kind of expected, but it came out through this data, is that urban green spaces and tree canopy coverage had pretty significant protective effects after controlling for a number of other variables when it comes to mortality from this event. Next slide, please, Craig. So this is some analysis that we've done at the Vancouver Coastal, within Vancouver Coastal Health, looking at a number of our hospitals and emergency department visits during this time period. So we saw a significant surge in heat-related emergency department visits. The blue lines on the bottom, this kind of graph of those very small spikes, shows you the data back to 2018. And this is data looking at heat-related emergency department visits. And you can see the huge spike on the left side of this graph, and that's the heat event that we experienced in June of this year. The orange image here shows you a more detailed breakdown of the event. And as you can see, on the hottest day of the event, which was June 28th, we saw the greatest surge in patients, but there was a surge happening right from the beginning of the event to the end of the event. During this event in the emergency departments, they also saw an increase in the severity of the presentation, and heat exhaustion and stroke were the most common diagnoses for those heat-related emergency department visits. Next slide, please. So just moving into something a little bit different here is our climate vulnerability mapping work. And so as Craig very clearly pointed out at the beginning, is that our health authority does a lot more than operate hospitals and healthcare. And we come from the public health team, where we work very closely with our local municipal governments, local non-governmental organizations. We support regional partners, and we support them on climate change mitigation actions, climate change adaptation actions, and also emergency response. So to help support the work that we're doing with these local partners, a few years ago, we created a set of climate vulnerability maps in collaboration with a number of researchers at UBC. And the purpose of these maps were to enhance engagement and conversation around adaptation activities, and to demonstrate and display that vulnerability from a health perspective is not just related to exposure to the climate hazards, but it's also related to the other kind of equity considerations, including the sensitivity of the population and also the adaptive capacity of that population. So we brought in a huge number of data sources together to display these maps. We created indices for both sensitivity and adaptive capacity. Sensitivity was primarily composed of pre-existing conditions and also age that were associated with the specific exposure based on a systematic literature review. And then also the adaptive capacity section was largely focused on, the standard social determinants of health, the ability of a community to adapt to these events, also based on a systematic literature review of the association with the exposure variables. So we created these maps for high temperatures, for wildfire smoke events, for ground level ozone, and also for flooding across the entire Vancouver Coastal Health and Fraser Health region. And more recently, they've been updated for the Interior Health region as well. Next slide, please, Craig. So this image on the left shows our climate vulnerability maps for heat, With the darker red, this is a specific snapshot of the city of Vancouver. And the darker red areas represent areas where our model predicted would be more impacted by heat health impacts. And we created these maps in advance of this summer event that we experienced, this summer heat event. The image on the right shows the residential address of patients who came to the ER during the heat event with heat-related illness. And we just wanted to show you that, you know, the patterns are not perfect, but they're quite similar in that the heat vulnerability mapping, based on the huge number of data sources and literature that we had reviewed, matches up fairly well with our with where we saw patients coming from in the region. And the heat vulnerability mapping includes, you know, green space coverage, NDVI for those of you who are in the mapping world, and other factors as well. So this is the type of data that we provide to municipal partners to assist them with decision making, you know, where to put cooling centers, where we might need to increase green space. And so we work quite closely with our municipal partners on this data, but also on a number of other interventions and approaches. So I'll pass it off now to Dr. Michael Schwant, who will be talking about the health system impacts and future planning.
Yeah, thanks very much, Emily and Craig, for walking us through some of the known impacts of climate change in BC, BCH, and elsewhere, and then also some of the specific impacts that we saw during the heat dome event and the mapping work that we've done. I'll talk a little bit more about some of the impacts we've observed in our health system, some of the adaptive action that we're taking around resilience for that, and then just a little bit as well about the overall picture for strategic planning around this topic in British Columbia and Vancouver coastal health. So this these points here really just describe the current state of things in BC. Right now, I think it's fair to say that this is a relatively, not a new topic to people's knowledge, but a new topic to concerted and resourced action. I think that we're seeing a very positive amount of investment in the assessment of risk and the planning that's necessary to enhance resilience right across the province. We were very fortunate in Vancouver Coastal Health and our neighbors Fraser Health to have acquired grant funding at an earlier stage. It's really, I think, shown the ability of that kind of funding to catalyze early action, and it's brought together both excellent staff that we've been able to employ, and then pulled in, I think, other resources that in turn, in a really positive feedback loop, we've started to develop a program that's growing rapidly as we speak. And a lot of that does flow from the external funding that we had initially. Again, we see more and more of this leadership coming essentially from our Ministry of Health in BC, which is excellent. There's work to do a little bit in the other 3 regional health authorities, some of that same work looking at the underlying health vulnerabilities, the system vulnerabilities that exist, and applying the well-known WHO BRACE framework to that. Right now, each regional health authority, regardless of their state, the current state of their vulnerability assessment, is certainly engaged in planning for climatic events and other issues related to climate change. And there's support, I should note, from an organization called Health Emergency Management BC that provides support, much like their title there, around emergency planning and response right across the province. So that's a resource for all 5 of the regional health authorities. Now, Craig had introduced a little bit about where we sit in terms of it being a public health program within a regional health authority. As you heard, each regional health authority, each of the 5 within British Columbia, delivers the acute care system, hospitals, many clinics, long-term care, home care, and a variety of other services. And so it's important to keep in mind that public health, rather than being situated in a municipality, as in some provinces, is situated in a regional health authority structure, which is the case in a variety of provinces as well. So this can have benefits in terms of a very close connection to the acute care system that I'll describe. It can also have challenges in that we are often at maybe 1 or 2 degrees of separation removed from municipal government and other important partners. So I don't know that there's a single right model, but this is the one that we're in, and it definitely has its benefits, but challenges that we need to understand and work with as well. You'll probably know many of you are, I think, largely a public health audience, know some of the functions of any public health program, of course, being monitoring, reporting, and action on community health status. We do make a number of recommendations to government at the local or provincial level based on the data that we see from events like the most recent events that Emily and Craig have described. We work a lot with communities on the planning for these climate-related events. And this is all part of the core public health services that we deliver all of the time. We're trying more and more to build climate change adaptation into each of these programs, whether that's these key pillars of public health, health protection, promotion, disease prevention, and surveillance, making these not part of not only a novel and new approach, which it is, but making this part of the core business of public health programs going forward. Now, talking about some of the health system impacts of the extreme heat event that we had in June and July of 2021, Emily characterized that, really tragic, really massive human toll that we experienced. And as well as that, we need to understand how this has affected our health system, our delivery to care for people who might be experiencing heat illness, but then all of the other functions of the healthcare system that can be affected and need to adapt and be resilient as well. So we certainly saw, as was well characterized in the previous slides, high patient volume in our emergency departments. This is numbers that were relatively unheard of, specifically for heat-related illness all at once. And I think it was well reported locally, and I think important to understand with this national audience, delays to care were noted in our ambulance system as well. So I think that the ability to manage that sort of surge at the levels of the 911 system, of the ambulance system, triage into emergency, that whole continuum of care for people who may be experiencing heat illness is really important to plan for, and to have the surge capacity in place to manage events that we need to, unfortunately, expect more and more of going forward. And we look at some of the programs that we deliver in the community as well, not just in the hospital, but programs like home care. So all of these services where medical care might be delivered once a week, maybe several times a week, maybe even daily or more in the homes of our local residents. And each of these services did amazing work during the heat event to try to increase the number of visits, to bring checking for heat illness to the work that they might have already been doing to help people manage chronic illness or other issues. It became very important, though, to understand the disparities in risk between these different patients and clients who are receiving services, because these programs, with the finite resources that they have, were very motivated to focus their efforts on those who are at most risk. So we had a lot of health equity considerations and a lot of work to bring an evidence base to the deployment of these resources. So, for example, looking at not only the age and the pre-existing health conditions, but the nature of the buildings that people are residing in, some of those other characteristics that Emily had mentioned, the green space of the areas of town that people are in, the known social supports. All of those issues have to come to bear to help us to make evidence-based decisions that can save lives during a heat event, we found. In terms of long care and assisted living, our residential care facilities, there was a lot of great work that went into monitoring the residents of these buildings, both the spaces that they're living in, trying to maintain cool temperatures where possible, and then also the residents' health themselves, who can be very vulnerable to extreme heat, mostly being older adults, oftentimes with multiple comorbidities. We found, and there has been research in other contexts describing that people living in long-term care, even though this is often a frail and elderly population, have been at lower risk than their age-matched peers living in community due to this close attention to both the space and the person that we're able to deliver. And I really need to note that across the dozens of long-term care homes in Vancouver Coastal Health that we are connected with, it's a large variation, as in other provinces, I'm sure, in the building materials, the air conditioning, all of the underlying characteristics of these facilities. So I think that there's an important note that we need to look at resilience in the design of our buildings. And we'll talk a little bit more about that in the subsequent slides. Mental health and substance use. These are life-saving services, what we're describing here. Services for people living potentially with substance use disorder or addictions, harm reduction services such as safe consumption, safe injection sites. It was very important to be able to continue and have continuity of care in these sites. And in fact, many of these sites were able to actually deliver cooling services, provide the cooler space, the option for people to stay around. This might be the only cool space that people who are underhoused have some access to. So this was something where we saw both Vancouver Coastal Health facilities and then some of our partners as well really stand up during the heat event and find a way to provide cool space for people who are at higher risk for heat-related illness. This is something that we need to plan for, though. This is, I think, ad hoc. We saw tremendous work that was done in the community, but we need to, again, anticipate both for extreme heat events, but then also air quality events like wildfires and others, have plans and the appropriate support for many of these organizations to deliver this, because a lot of them are going far above and beyond to manage this during the heat wave. And then in terms of our public health program, as well as all of the planning that I've described, we're really trying to stand up a more effective program of surveillance for heat-related illness, looking at everything in that continuum of care, from emergency room visits, ambulance calls, hospitalization and mortality surveillance, among other issues such as mental health we want to monitor for, and not just in heat, but in all of the different potential impacts of climate change. We also have our environmental health officers, also known as health inspectors, going to various facilities, giving advice on how to create more cool spaces. It's probably well known to many of you that being in a more temperate climate, as Craig mentioned here in the lower mainland of British Columbia, many of these spaces that are delivering services, many of our residential care facilities do not have air conditioning in a way that they're able to maintain a stable and cool temperature. So being able to either add that or to make changes in those buildings before rather than during extreme heat events is really important. And our public health, our environmental health officer expertise has been very valuable in that regard. So as we mentioned, it's not just extreme heat. That might be one of the most intuitive health pathways to health impacts of climate change. Only just months after the extreme heat event in June and July, we had in November an atmospheric river event. Again, this involved the flooding of the Coquihalla River, among several others. And we saw in that time severe interruptions, as you can see, to transportation, homes unfortunately destroyed or certainly rendered uninhabitable in the most immediate aftermath of these events. Huge impacts on the health system as well in a number of ways, as you can imagine, just looking at some of these photos. And of course, I should note, quite tragically, in the events themselves with overland flooding, we do have a risk of immediate death and injury, and we did have quite unfortunately and tragically some of those impacts in British Columbia. One positive story I wanted to highlight, and I think with hopeful expansion to our approach to climate change adaptation more generally, is this photo of the helicopters from our partners at Health Emergency Management BC. And it was recognized in one small town. This is the town of Hope, BC, which is about 6,000 people in Fraser Health, just to the east of us in British Columbia. Has a pharmacy that had one core staff person. In fact, the operator of the pharmacy was unable to reach the pharmacy and dispense vital medications on a day-to-day basis for people who were able to get to the pharmacy within their town, but this town was completely cut off from the surrounding area. HEMBC was able to, in the moment, find a way to literally fly this individual in to provide these important services. This is for people who might be needing daily management of health issues like diabetes, for example, other important care whose health could be impacted in that. And I bring this up because this is, I think, a true microcosm of the massive impacts that you can imagine if you multiply that sort of single facility impact across a health system with thousands of employees, hundreds of facilities, and think of all of the potential impacts on healthcare that could produce. We really need to, as part of climate change adaptation, identify all of these vulnerabilities as we're working to in Vancouver Coastal, and then plan to mitigate them with specific plans. Because there's many solutions. We have a great partners who are able to, in the moment, provide solutions to this effect. But cataloging and understanding these and taking action, again, before and not during events is something that we really want to expand on locally. So to that end, we have developed a climate change and health adaptation framework within Vancouver Coastal Health. So this is, again, under the Health Adapt funding that we described earlier, and it's flowing directly from that climate change vulnerability and capacity assessment that Craig introduced. And this is really, in short, a strategic plan that describes actions both for our public health program, for Health Emergency Management BC, for our facilities, and other programs that are either in the health system or affecting the health system. So in some cases, other government and community partners. And this has gone through, again, close review, both in terms of our evidence that we consult, a lot of consultation with internal and external leaders and community members, looking at the best practices that we've seen globally and how those might be applied locally as well. So there's been several phases of this consultation, and we're very excited to release this, strategic framework and also, I think most importantly, begin acting on it. Some of the key pillars of it are emergency preparedness and response, as you'll well imagine, risk assessment and surveillance, something that I think is absolutely crucial to be able to understand and respond to events that we expect to increase over coming years, communications, leadership and advocacy, and also health equity being a major pillar. And we have a number of recommendations under each of those pillars that we're really looking forward to getting to work on. Some of the emerging programs that we have in terms of action at Vancouver Coastal Health has been flowing from the June 2021 heat event. Every Vancouver Coastal Health program has been required to, and in fact has, either developed or updated a seasonal readiness plan, specifically for extreme heat, and we've seen the impacts of that, and also smoke, chiefly wildfire smoke in our area. And this is, again, I think very important to write down to the program level, whether we're talking about an emergency room, a small long-term care home, a very large home, a program delivering care to hundreds or thousands of home care patients. Each program looking at staffing, transportation, facilities, every element that's potentially affected by these climate events. We're going to add winter events as well to this, flooding and ice storms, other potential events. And again, this is part of our climate adaptation, that we're going to be ready for these events as they happen. So there's a steering committee right across our health system that's coordinating this, and every one of these plans has input from our public health program. So people like Emily, Craig, and myself have a hand on each of those. And I really wanted to mention as well our planetary health program at Vancouver Coastal Health. It's so important that even while we continue to take part in climate change adaptation, building resilience, we know that those are crucial. That's what we're here to talk about today. It's so important that we continue to keep an eye and very, very strong efforts on climate change mitigation. As we saw in that introductory graph right at the beginning, without mitigation, we're going to have much more to adapt to. In fact, many of our systems will be completely unmanageable as we know them right now if we aren't able to actually mitigate climate change as well. And in many cases, we think that these commitments go hand in hand. They're actually mutually supportive. So it's not an either-or question to us. In our health authority, we really think that doing both of those is important. We have a new planetary health program in the region that's looking at many different streams of climate change mitigation, from facilities to transportation, sustainable foods, consumables, products and waste within the health system, which you can understand are very, very large amounts of opportunities, I should say, for improved sustainability. And again, oftentimes mitigation and adaptation are, some people say, two sides of the same coin, and I'd say even more, I'd challenge that and say even more closely joined than that. When we look at low carbon, climate resilient facilities, these plainly can have an impact both in climate change mitigation and are also adaptive and more resilient. So I think that this mitigation and adaptation connection is very important, and we're trying to grow that in our day-to-day work. And then just to wrap up, this is a figure that we've put together. We found it's helpful to share with partners, with the public. We have it on our website. Just looking at all of the different areas that we're hoping to work on, and we already are in many cases, and trying to grow those efforts, whether that's related to the healthcare system itself. You see there, positioned in the front and center as we would, but then also the transportation systems, our community design, how we manage ecosystems. This work does require connection to, again, other parts of society, other parts of government, to ensure that we're able to become a more resilient community and protect health in the context of climate change. So we're really looking forward to having a bit of discussion. That's I guess the remainder of the presentation that we have. I see that there may be some questions, and we'll be glad to answer them. And then again, thanks to our team. It's a small group of people who are formally and full and dedicated to this. Some of us part of our time, some of us all of our work assignment. And this is work that we do think needs to grow to accomplish all that's going to be required to protect our populations from health effects of climate change. So thanks to Craig and Emily, really appreciate it.
Wonderful. That was really impressive. So Craig and Emily and Michael, thank you so much. I think we can all maybe turn on our cameras for this conversation. We do have some questions coming in on the chat, but I'm going to take the privilege of the chair and start with the first question, if I may. So I'm sitting here in Toronto, Ontario, looking across the country, and it strikes me, and did before this talk, that British Columbia is probably one of the best prepared provinces for climate events. Vancouver Coastal and other health authorities, some of the best prepared health authorities. You've done an impressive amount of work. So you're in some ways a best case scenario. And were there, I'm interested to know if there were things that, despite all the work that you had done being part of the Health Adapt program, you had to pivot, or you found weaknesses or particular gaps that perhaps hadn't been anticipated, or maybe everything had been anticipated, but you weren't quite ready to ramp up. I'm really interested to know how well prepared you were, in a sense.
Yeah, I can speak a little bit to that. I mean, I think that when we look at the impacts of the extreme heat event in 2021, I think that we'll find that the society was not prepared adequately yet. I think that we, in many cases, have the knowledge, we have the best practices and that understanding. I think those plans have been well developed and articulated. We have great examples from around the world. And I think, again, the plans in Vancouver, I think that some of the next steps are going to be to enhance the all of society effort that's going to be required to respond to some of these issues. We're in, I would say, fierce pre-season discussion with, in a positive way, with our municipal governments, with community-based partners, really to identify all of the different roles, all of the responsibilities that would take place during these emergency events. So I think that one of the potential gaps or areas for improvement is going to be just the ability to leverage and move all of the resources necessary for true emergency events, overland floods, extreme heat, and things like that. I think that the coordination of that, we have a lot of interested and active partners, but coordinating who's doing what during those events is something that we still need to go, I think, a little bit further to have a formal plan in place so that we're not figuring it out as the mercury rises.
I would just add too, Fiona, if I could, slightly different angle than Michael, but I think for me, what I've seen, the need to pivot arises from just the rapid evolution in this space. Like, when we started this project, the Ministry of Health hadn't been fortunate enough to be aligned with the Climate Action Secretariat through the Climate Preparedness and Adaptation Strategy to really take the leadership role that they are. BC CDC continues to astound us with the progress that they make, the First Nations Health Authority. So I think it's sometimes we'll identify a priority area and within a month, it's kind of changed. There's new leadership in that area. And obviously we're extremely thankful for that. And I think it keeps us on our toes in a good way, though.
That's great. Okay, so I'll ask some of the questions from, I'm so sorry, Emily, please jump in.
I just wanted to add one more thing, which is to say that in our preparations as well for these two events were huge. We were expecting these events, flooding to this extent that would block off all of the highways to the Lower Mainland. We had done exercises on these. We were planning for heat events, very significant heat events, but the magnitude of these events over the last summer was just something that we were looking 20 years out, maybe at our planning processes, how we're going to get ourselves there. So I think it's just to recognize that about these events and how now it's realized, it's right here, it's right now, and we need to be very fast in our approach to this. Yeah.
Right. So I'm going to ask a question for Edward Shea. He thanks you very much for these presentations and about this adaptation, strategic plan and framework that you've put together. Are there implementation uncertainties or anticipated challenges that there's an important role for research and exploring, or is it get it done type of challenge?
Yeah, and I'll look to my colleagues again to add, but just to start off the answer there, I think one of the major challenges is going to be resourcing what's necessary for climate change adaptation. I think that our strategy describes a cross-system approach, both for the health system and in fact a cross-society approach. But many of these things are going to take some investment, whether that's the people power to get some of these things done, the development of different infrastructure. All of those things are going to take a very concerted effort, and we're not shy to say a very concerted funding to put these things in place. So we do have new developments in BC, a climate preparedness action strategy from the province with funding allotments to that. Again, we're talking about this live and direct as we watch and wait to find out exactly how that will transpire. But I think that in Vancouver Coastal Health, and probably in the organizations that many people in the audience are working for, there's a good sense for the practices that we could put into place, but being able to support and resource those is going to be really crucial, so that we're not just talking about them and writing them down, but putting them into action. Anything that you'd add, Emily?
No, that's great, Michael.
Greg?
Yeah, I'd jump in and just say, I think probably all three of us are enrolled for a webinar on implementation science next week. I think there's a lot of evolution in this space, and I think we have a sense internally what it's going to take to drive this. But because our work is so collaborative, anyone who's done this type of work knows how complex that can be. You want to collaborate effectively. You don't want to over collaborate. You don't want to bust silos that should probably be left standing. So I think there's a role for researchers sometimes in helping us bring novel approaches to those processes. I think too, monitoring and evaluation, this work is extremely difficult to demonstrate the impact of. And I think academics in their ability and researchers in their ability to survey those various methods that are rapidly evolving, I think informing our work with those is going to be really valuable too, because we need to show that we've picked the right things to do and that we're doing them effectively. I think that's the next era of adaptation, is this accountability around the change-making process. So I think those are a couple areas that came to my mind.
Yeah, that's really interesting. So Edward, you have your work cut out for you. You've got the research challenge. So Kavishajanya asks how well we are able to predict these events. You said, the world was shocked by the scale of them, but leading up, could you anticipate that this was happening? How many days warning might a region have to invoke the strategies needed, the surge plans and so on?
Yeah, unfortunately, we're looking at, in many cases, days, if that, in terms of our lead-in for either extreme heat, flooding and wildfires, with a little bit more time, because these can be the sequelae of other events. I think it's important to keep in mind that we can predict. We often say that we can predict that these will happen, and not necessarily as well when they will happen. So I think that preparedness, same sort of approach that here in BC, we've historically brought to seismic preparedness, thinking of what is that worst case scenario, and making it a baseline expectation and accountability that organizations need to be prepared for that. Again, with no idea exactly when that might be. As Emily mentioned, we've had some sense, some projections for what these worst case scenarios might be with extreme heat. But even our colleagues in Environment Canada, meteorologists in Canada, and also the Pacific Northwest and Washington and Oregon, widely agreed that this was an event that was seen as possible, but not projected to happen in the summer of 2021 in particular. And whether it happens in the summer of 2022 or not, I think we need to plan as if it may.
Emily, can I put you on the spot and just put you back into that week leading up to the heat event, and not the particulars, but just what that was like? You were, I think, watching that and saw what's coming, but still 48 hours, whatever it was.
Yeah, there was, you get a beginning, you say, oh, you look at the forecast, it's going to be hot, but it's not predicted to have an event like this. And then you start to pay attention a little bit further and say, oh, it's going to be pretty hot. And as the forecast came along, the temperatures just kept rising and rising and rising in the forecast as you got closer and closer to that event, until, we didn't know we were going to hit what we call our, heat health emergency thresholds until really when it was happening. The models were not predicting that until right when it was happening. So we had a sense, a couple days out, that this was going to be a major event and a significant heat event, but the magnitude of that event really was not known until pretty much when it was happening. And same with the flooding event as well. We were looking at the rainfall projections, and during the event, it just kept getting worse and worse and worse during the event. So I think it's, from a forecasting perspective, you don't have a lot of leeway before these events.
Right. Well, can I ask, The other thing is that when we think about resilience, we think about preparation, we think about emergency response, and we think about recovery, perhaps, and also perhaps differentiating acute from chronic challenges. I'm wondering if clearly you're good at anticipating, clearly you're good at responding. Is there as much capacity for recovery for some of the chronic impacts of acute events, or is this all equally well kind of thought through and managed?
Yeah, really interesting question. And I would venture that our preparedness for those acute impacts we've made strides in that area around emergency preparedness and response. I think that our knowledge and our preparedness for some of those longer range impacts, I think lags behind, in honesty. I think that looking at the mental health impacts of climate change, for example, of experiencing heat events, wildfire smoke events in our population, the impacts the developmental impacts for children who might be differently able to interact with their natural environments over time, or just enjoy this time outdoors. People who are, all of those things. I think that we need to look at those chronic impacts of climate change as well. And as a health system, try to prepare for those. Often our discussions and the resources that we have do turn immediately to those acute impacts. If there's a heat wave or a wildfire in the forest next door. But I really think, I'm glad that you asked that we need to continue to build on our response to the chronic and long-term impacts too.
I will say that when it comes to kind of our community work, we are working on, I would say, like longer term adaptation options. If we think about, increasing green space in our communities and working on building codes and building design. As Michael had previously mentioned, most buildings in our area don't have air conditioning. So that's got significant implications for future climate risk. And so thinking about those types of things. And then I would also just add that we look to the researchers, Edward, I think it was the one who asked the question earlier about developing better methods to measure these more chronic impacts after these events. And we do have a sense of the acute impacts from these events, but we need better methods to really understand the health implications and the wide-reaching and holistic health implications of these events, and maybe when we end up having multiple events stacked on top of each other as well.
I would just add quickly, if I could, Fiona, I know we're almost out of time. Those are excellent points by Emily and Michael. And the only thing I would add is that it can be challenging for sure to just like convincing folks to take action on sea level rise can be challenging because the impacts are oftentimes 40, 50 years out. But I think that's kind of our job. I think the three of us view that as, okay, we've made a lot of progress in the last few years. And in this next phase, we continue to bring those lesser known or lower, narratively impactful connections to climate change and health to the forefront when we're talking with our community partners and with decision makers internally. So yeah, again, great question.
That's wonderful. And I know we have more and we could have more discussion, but I would like to close this in time, but I do want to ask you before I close for some I know this is very unfair, key recommendations to health systems, delivery organizations across the country. What are some of the key things you would suggest folks really start to do if they aren't already doing it? I'm sure they are, but what are the things they really need to not forget?
I mean, one of the things I mentioned, and the other frameworks right described this, like the WHO's BRACE framework and so on, getting that initial assessment of the current state impacts that have been seen to date, where are those vulnerabilities and the capacities as well that have been developed. Very important first step. And I think that so much of our work right now is flowing from that hard work, and sometimes with the events actively happening right now, as Greg said, we're in it, to go about and do that assessment as we, often as the ship is sailing, as they say. Very important though to have a data-driven approach. The thing that I'd add, just to wrap up from myself before my colleagues, is that having high-level leadership. So advocating to the higher level leaders in an organization, whoever that might be, has been that, as VCH, I think we've really benefited from the commitment of our Chief Medical Health Officer, from you can imagine the executives, the board, all of that sort of engagement to go ahead with this work, know that it will be well supported, in time, I think that that's really allowed the program to grow. So, we could describe some of the technical steps to go ahead, but I really think that finding ways to get high-level leadership on board is crucial to the investment and commitment that's necessary for this work.
Onwards, Craig or Emily.
I'll just add in one piece is, develop robust surveillance systems now as well, so you can easily monitor the health impacts. So know what your guess of what future events that may impact your region are, and then create those surveillance systems at this point, so you can monitor the emergency department in real time as the events are happening, so that you can monitor the distribution of patients. You can start to think about the mortality impacts and other impacts to the community, because I will say that, from a public health perspective, our community organizations look to us to provide that data in real time for their decision making, for our decision making. So I think it's really important to develop those ahead of time.
Brilliant. Thank you so much, Michael Schwant, Emily Peterson, Craig Brown. That was incredibly helpful, incredibly informative. I can't thank you enough for sharing your expertise with us here and across the country. For those of you listening, there is a feedback form posted in the chat, sent out with respect to email. We have another event next Wednesday as we think about climate positive healthcare and many other things happening. Look at our website, cascadescanada1word.ca. Thank you again, and have a good rest of your day wherever you are.